Good morning, everybody. My name's Nick Morris. I'm a consultant gynaecologist based in London, and I'm here today to tell you about a new, exciting diagnostic test for endometriosis. I have a short presentation on PowerPoint, and I'd like to take you through it. Today, I'd like to tell you about EndoSure, which is, I believe, the future diagnostic test for endometriosis. This is a rapid, non-invasive test. No blood tests are involved, no surgeries involved. It's a 40-minute test, and results are normally available within the day. Now, we know as gynecologists that many women are terrified they have endometriosis. This test allows all these women who have this fear to potentially be treated conservatively in a very similar way to PCOS by having appropriate medical treatment. We also know that if this test is negative, but these women have pain, they can avoid laparoscopy and can be promptly referred to gastroenterologists to monitor and to determine the nature of their problem. We also use the EndoSure test to monitor the condition and also whether it's recurred and also whether it's been successfully treated. Let's go back in time. So if we look at the history of endometriosis, it's not very long. It goes back to the late 19th century when von Rotyskansky discovered endometriosis in histological specimens. So what we do know is that for centuries, many doctors thought that the symptoms of endometriosis were hysteria. And we now know that many doctors, including Freud, whose famous couch is in this slide, diagnose hysteria rather than endometriosis. So if you look at the bottom two bullet points on this slide, it really tells us that women with endometriosis were victims of the most colossal mass misdiagnosis in human history. One that over many centuries has subjected women to murder, madhouses, and lives of unremitting physical, social, and psychological pain. The number of lives that have been affected by such century-long misdiagnosis is staggering to consider, likely involving figures in the multiple millions. It wasn't always like this. Galen, who was a very famous Roman doctor who even lived in the UK for a while, described the suffocation of the womb. He did this without much knowledge, much scientific support, but using his incredible powers of assessment, he diagnosed this condition. And if you look at the third bullet point, he said he gave fresh insight into this condition, which suggested that endometriosis was infiltration into the ligaments and the uterus. Galen provided these new clinical symptoms as part of his proposed theory of pathogenesis, which suggested there was suffocation of the womb. We now call this adenomyosis. And in the Middle Ages, experts confirmed again that this was uterine suffocation, adenomyosis, or endometriosis. Cuthbert Lockyer, a British gynecologist who worked in the 19th and 20th centuries at Charing Cross Hospital, was initially not a doctor. It took him a long time to get into medical school, but he probably was the British pioneer of endometriosis. And as a result of his extensive work in the 19th and early 20th century, he built up an incredible series of specimens and diagnosed the condition of invasive endometriosis. He diagnosed and published a very important book in 1918, Fibroids and Allied Tumours. And he was one of the first British gynecologists successfully treated cancer. He talked about endometriosis affecting the bowel, causing problems with defecation, constipation, and bowel obstruction. Cullen was a Canadian gynecologist who worked at a similar time. And here is a picture from one of his many publications. And he confirmed that there was extensive endometriosis affecting the small and large bowel. And he became the first to realize that endometriosis was able to invade the pelvic nerves, a process causing patients excruciating pain when the pelvic nerves are invaded and when their periods happen. Freud called it hysteria, so did other doctors over the centuries, but Cullen and Cuthbert Lockyer got it right. Now we move to this century, and Mark Noah, who is an inventor, a neuroenterologist, a gastroenterologist, and an expert at endometriosis, developed a new way of assessing endometriosis, electrovisography. And it's all to do with prostaglandins, which are small hormones that affect the motility, the mobile nature of the small bowel. And this is what the electroviscerogram diagnoses, the new diagnostic test. And here we can see how these prostaglandins, these small molecules, work. And if you look at the third slide, number 3, it shows that the effect of the release of the prostaglandins, which are increased in greater quantity in women with endometriosis, causes increased bowel movement. And this is the basis of the test. And if you come and have the test with me, this is what it looks like. You have a monitor strapped across your chest. You have a monitor that records the movements of the bowel. And in the third picture, you can see the electrode attachments to your abdomen. Completely non-invasive and very simple. The test takes about 40 minutes. So here we have 2 results. In the upper part of the picture, you can see a normal result, where the features of the EVG look entirely normal. And on the bottom part, on the left-hand side, you can see the abnormal result. And these results will be available within the day when our technicians have been able to report on them. So it's a low-cost, portable test, non-intensive, no laboratories are necessary, and we can now provide this test around the country to help women with this condition. So my name is Nick Morris. I'm a consultant gynaecologist in London. At present, I'm offering the EndoSure test in London. You can contact my office at the numbers below and on that email address to book an appointment. I hopefully will be offering the test in Manchester fairly soon. Thank you for your time today. Please email me with any questions at secretary@rapidaccessgynaecology.co.uk.